Okay, this is Dr. Thornley, and this is part 16 of my medical marijuana series. And today I'll be talking about the cannabinoid system and its effect on cardiomyocytes as well as the GI tract, because when I was reviewing the literature before I started this, the two probably most serious adverse outcomes in someone who uses it recreationally are myocardial infarcts as well as schizophrenia, but there's also the most common side effects include the GI tract and neuropsychiatric symptoms. However, there is some effect on the heart. So I thought I would delve into this more deeply, and it also can cause tachycardia. So I reviewed the literature to try to understand why these things happen. And today it's May 9, 2018, and probably in the future, 5 months from now, 5 years from now, everything I say may be negated by future research. Okay, so in the cardiomyocytes, or the cells of the cardiac tissue, the heart, when it's ingested, a side effect can include tachycardia, meaning increased heart rate. So patients may be cautioned about this in case they have heart conditions, including tachycardia. And what happens is that the CYP, or cytochrome 2J2, metabolizes anandamide into cardiac epoxides, which are cardioprotective. So just to review the mechanism or the pathway, within our system there's an endocannabinoid pathway, and that is responsible for the runner's high that people get, not endorphins like most commonly known, because those molecules are too large to penetrate the blood-brain barrier. So the endocannabinoid pathway, there are two metabolites called anandamide, on which THC works on, or is a mimetic, tetrahydrocannabinol, and that's the substance that people are more familiar with. It's present in when people use it recreationally. And then there's another metabolite within that pathway called 2-AG, 2-arachidonylglycerol. And the one that works on that is cannabidiol. There are also two receptors that are well known within the endocannabinoid system. CB1 is the receptor on which THC works on, as well as anandamide. And then cannabidiol has a very weak affinity. You need 100 times to get the same psychoactive properties as THC. So that is endocannabinoid pathway and system, the most salient points in a nutshell. So anyway, going back to the cardiomyocytes. So the cytochrome, so CYP 2J2, it metabolizes anandamide, which is found within that pathway, and then it metabolizes it into cardioprotective epoxides. So when THC is introduced to the system, so you have exogenous cannabinoids, then it's metabolized more quickly, and you don't get the same cardioprotective effects when anandamide is metabolized. And then, this was a study by Arnold in 2018. And then in another study, there was another study in the Drug Metabolism Review, which just recently came out. In 2014, which showed that cytochromes can metabolize cannabinoids. So cannabinoids is just a term encompassing the THC and the cannabidiol. So cannabinoids mean those that are exogenous, meaning they are introduced from outside. Endocannabinoids are the cannabinoids within your system. So that would be 2-AG and anandamide. Okay, so CYP, or cytochrome, these are enzymes which are found in the liver. They metabolize cannabinoids, so that's THC and cannabidiol. And then by the same token, THC and cannabidiol can also metabolize the cytochrome. So doctors need to be aware of these, because there's some drug-drug interactions that can occur. With Onfi, which is an anti-epileptic agent, it was found that it is metabolized less when THC is introduced, and so the levels can go up. So if you know your mechanisms, your physiology, how your drugs are broken down, then this can help guide you when medical marijuana is taken in conjunction with conventional agents, especially those that have to do with the heart and with epilepsy. And then there's also been another study that came out which looks into the cannabinoid hyperemesis syndrome. So when I was reading all the literature, again, the most common side effects are neuropsychiatric, as well as, which I reviewed in one of my previous videos on schizophrenia and psychosis, as well as GI symptoms. So many patients may complain at high doses of cannabidiol. In the studies of 1,000 milligrams, they complain of nausea, vomiting, diarrhea. Also, there have been some other studies with Sativex, GI symptoms including nausea, vomiting, stomach upset. So these are common symptoms when exogenous cannabinoids are taken in. And there's one syndrome which can cause a more severe type of extension to this side effect called the cannabinoid hyperemesis syndrome. So this is something that needs to be brought up in someone who abuses it regularly. I couldn't find any literature on medical dosage and medical marijuana, but it's probably a reflection of the common mild side effects related to the GI tract. But anyway, with this syndrome, it was found more commonly in those who used it recreationally. They heavily used it, and usually when patients use it recreationally, it can be synthetic, which could be more potent. There could be additives, and the dosage is much higher than that seen in medical marijuana. So the endocannabinoid system works on the GI tract. It regulates it. When exogenous cannabinoids are introduced, then there's dysregulation, there's slow GI motility, and then there's less sensitivity of the CB1 receptor to the endocannabinoid system. And so the whole pathway in the system is dysregulated, and this causes cyclic vomiting, nausea, and GI upset. And then a lot of the patients found that with hot water, they can relieve their symptoms, and this is through a mechanism by the TPRV receptor, which is a G protein coupled receptor. G-related protein. So these are just some of the side effects and some of the possible symptoms that could be related in the use of medical marijuana. But again, with the cannabinoid hyperemesis syndrome, this was found in patients or in people who used it recreationally at high dosages, and unclear what the mode was, whether synthetic or if additives were, but just something to be aware of. And also with medical marijuana, people do complain of GI symptoms, so it's all probably related to each other. And this was in an article that was described by LaPointe in March 2018, which recently came out. So just to recap, to summarize, the cannabinoids can impact cardiomyocytes and can cause tachycardia because of various mechanisms that I just described through the cytochrome 2J2. And then it also has impact on the GI system, can cause mild symptoms of nausea, vomiting, diarrhea. However, in those who've used it recreationally, it can cause a condition called cannabinoid hyperemesis syndrome. All right, so I hope that was helpful. And so these are just some recent articles that I reviewed, because when patients always ask me about common side effects, if there's drug-drug interaction, then I look at the literature. But again, some of the literature pertains to those who have used it in the past recreationally, so there haven't been too many current studies on medical dosaging with medical administration, so the side effects will be very different. And it's very difficult to extrapolate what was studied in those who used it recreationally at high doses, additives, synthetics, compared to those using it in a medical way with a medical administration. However, there is something to be said that it does cause tachycardia in cardiomyocytes, even with medical dosaging. Okay, all right, so that's to recap, and this is Dr. Thornley signing off.